Hey everyone, this is Brad Mayfield. I'm the Director of Business Development for Greater Therapy Centers. Miguel's having a little bit of technical trouble, so if you can hang with us just for a second, we should be able to get started in less than 5 minutes. We'll be right back with you. Thanks. Okay, Miguel, do we have you? Hello, Miguel, do we have you? All right, see your screen, but I don't hear you. Just hang tight, everyone. We're getting this together. Yeah, there we go. I hear you, Miguel.
There you go.
Don't see you, but I can hear you.
Let's see.
There
Better?
you are.
There we
All
go.
right.
All
All right.
right.
Got everybody on and unmuted, and we are recording. Is it all right if we go ahead and get started?
Yeah, let's go ahead.
Okay, I'm going to give you everybody the brief intro here, your background, and then we'll turn it over to you. Thanks for joining us, everybody. I'm Brad. I'm the Director of Business Development for Greater Therapy Centers. We're hosting these webinars every weekday through May 1st, a different topic every day, hosted by our physical therapist. Today is Miguel Valle. Miguel received his bachelor's degree in kinesiology with a minor in Spanish at the University of North Texas in Denton. He later went on to earn his doctorate of physical therapy at the University of North Texas Health Science Center. Miguel worked full-time in an outpatient orthopedic clinic for over 3 years while also working PRN in an adult inpatient rehab hospital. Miguel has experience working with orthopedic patients of all ages and diagnoses and is certified in dry needling. He has been with Greater Therapy Centers since April of 2019. In his free time, he enjoys spending time with his wife, Melanie, who is a pediatric physical therapist, and his beautiful daughter, Nina. Some of his hobbies include grilling, running, hiking, bike riding, and walking his dogs, Chevy and Mia. Miguel also enjoys exercising, including weight training, running, and boxing. Lastly, he likes to explore different areas and activities in the DFW area, including live music venues, salsa dancing, watching movies, and trying out new restaurants. Miguel's personal goal is to work together with each individual patient to achieve their personal goals through movement. He also wants to continue to learn and gain proficiency with a multitude of techniques that can be used to address the specific needs of each patient. Okay, so with that, I'm going to turn the webinar over to Miguel. I'm going to mute myself. If anybody has questions, you can type those in the question section below. We will take some time at the end of this webinar to address questions. Otherwise, take it away, Miguel. Thanks.
All right. Thank you so much, Brad. All right, guys. How's everybody doing? I hope everybody's doing well. If you didn't catch my last webinar last Wednesday, please go check it out at our Greater Therapy Center Facebook page. It'll give you a link to all the other webinars, especially if you're having some neck pain and headaches. I did a webinar over that, so please go check us out. Take a look at it if you didn't catch my last webinar. All right. Today we're going to kind of talk about a little bit of sciatica, what it is, how it occurs, and how to take care of that, or how to manage those symptoms at home, okay? So let's go ahead and jump into it. Let's see. All right, so the objectives today, we're just going to understand a little bit about what sciatica is, some of the common causes that causes sciatic nerve pain. We'll briefly discuss how it affects us, And I'll give you a little bit of overview of how the sciatic nerve kind of runs through our body and why that's so important. And of course, I'm going to show you some exercises that kind of help take care of that issue. All right. So sciatica. What is sciatica? So sciatica is shooting burning pain that affects the sciatic nerve. Typically, it's known as lumbar radiculopathy. So what that means is it starts from your back. So the sciatic nerve originates from the back and it goes all the way to your bottom, all the way down to your legs, sometimes into your toes if it's that acute or early onset of sciatic nerve pain, or if it's just irritated for a long period of time. It can go all the way down to your leg. So what can cause sciatica? Obesity can, or being overweight. That increase in load on your spine can cause degenerative changes on your spine, where the nerve roots kind of come out and it can get pinched or clamped on. The discs between each segment of the spine can become a little bit smaller and thinner. So obesity can impact your spine quite a bit. Lumbar spine stenosis. So with lumbar spine stenosis, what that means is it's just the narrowing of the spinal foramina. What that means is, again, like what I was saying earlier, is you have these nerve roots on your spine, and these nerve roots come out in between each section of the spine. And when that little canal between the bones of the spine, when it shortens or becomes thinner, that nerve root is getting compressed. So it creates inflammation and irritation, and it'll start sending these referred pain patterns down your leg. So that is what sciatica is. It causes sciatica. Piriformis syndrome. So the way the nerve kind of runs through our body, you can also get piriformis syndrome. So all of this causes sciatica. Piriformis syndrome is where the muscle in your bottom gets really tight and it can compress on the nerve. Or with some people are just wired just a little differently, and the nerve can actually pierce through that muscle, and every time you try to contract, sit on it, on your bottom, it starts to get these symptoms down your leg. It starts to cause those sciatic nerve symptoms. So that's what piriformis syndrome is. Disc herniation or bulging, they're two completely different things, but they do cause similar symptoms. So disc herniation is where, think of the disc as a jelly-filled donut. The jelly in the middle gets pushed out of the donut into the nerve. So that's a disc herniation. Whereas a bulging disc is a little bit different. So you still have the jelly filled inside of the donut, but the actual donut part, the outer rim, is what's pushing out of the spine. So that's what a disc bulge is compared to disc herniation. And you can get it completely different. Disc bulging is a lot more common than disc herniation. Disc herniation, typically you get that from more of a traumatic issue like motor vehicle accident. Disc bulging is something that you can get, let's just say, from improper lifting, or some of you probably have disc bulges right now and y'all have no idea. And it's okay to have disc bulges. It doesn't mean that it's going to cause sciatic nerve pain or you're going to have pain. Disc bulging is actually so common that there's so many people out there walking right now that they have no idea that they even have it. So it just depends, but disc herniation is usually the worst of the two, and it's like, I don't know, I want to say it's like 10% of people have disc herniations if they have sciatic nerve pain. It's very low. I know with lumbar stenosis, that does occur only about 10% of the time of all low back pain. But anyways, let's move on. Pregnancy. So women who are pregnant, as the uterus grows and the baby grows, it starts to kind of shift some of the joints around. And what happens is, as the baby and the uterus is growing, it gets very close to the sciatic nerve that it becomes compressed. So pregnancy can cause, you can get symptoms of sciatica if you are pregnant. So who gets sciatica? Anyone can get sciatic nerve pain. However, it typically affects 30-year-old to 50 years of age there. But anybody can get sciatic nerve pain. So let's talk about those diagnoses that I mentioned earlier, just to kind of give you guys a visual of what lumbar stenosis is. So if you look on the left side here, you'll see a nice normal spine where the nerve root is coming out, and there's ample space right around the nerve root. What happens is, let's just say, we're a little overweight and we start to have thinning of the discs here. Okay, when that thins out and the canals, the foramen canals, close onto the nerve, it causes a lot of irritation there. That's what the red is, of that compressed nerve root. So when that happens, you're going to start developing those sciatic nerve symptoms. On the right side, just like what I was saying about piriformis syndrome, here's just another visual. That's the sciatic nerve root. It's huge. It is the longest nerve in our body. It starts from our back and it goes all the way underneath the piriformis muscle most of the time. Some people, again, are wired differently, and it can, on the right side, it can pierce the muscle. And when you sit on your bottom, contract the muscle, sometimes it can cause those symptoms shooting down your leg. So that's what piriformis syndrome looks like. Next, let's talk about disc herniation first. So again, the lumbar disc herniation. Here's another visual of the jelly donut that I was discussing. What happens is, with that jelly-filled donut, if it comes out, that jelly part, the middle part there comes out, it can compress the nerve root there, as demonstrated on this illustration here. And that's how you can also get symptoms of sciatic nerve pain. At the very bottom, that's what you see, a normal, healthy disc down there. And then pregnancy, just like I was saying, look how close the sciatic nerve is to the growing uterus there. So there's a high chance of it compressing the nerve, but it's only temporary. Most people, once the baby is born, typically the symptoms start to alleviate. If they don't, it's very rare if it doesn't, but there always are techniques to treat that. So again, it originates from the spine. You get this burning sensation down your leg, demonstrated here on the right side where it's colored green. You can see it go all the way from the spine all the way down to the lateral, or the outside of the foot there. All right, so sciatic nerve anatomy. So what is the sciatic nerve? It's the longest nerve in the body, and it branches throughout the leg. So you're going to see on the left-hand side, look how huge that thing is. Like, that's in our body. It's a big nerve. And depending on where it gets compressed, it can affect different parts of our body. So it doesn't have to get compressed at the spine to cause sciatic nerve symptoms. It can get compressed again in the glutes, where the piriformis is at. There can be an entrapment somewhere because of very tight hamstrings, and so forth. So why is sciatic nerve important? Well, it sends signals to the muscles from the brain. So those signals get sent to the back of the leg, side of the leg, and to the foot. So it's very important for movement. If the nerve gets compressed for a long period of time, it can actually inhibit some of your movement. So like drop foot. If you've had lumbar radiculopathy, which is sciatica, for a long period of time, and you notice like I can't lift up my toe or I can't lift my foot up, that's the reason why. It's just being compressed for a long period of time that it actually started to cause nerve damage. So we'll show you some exercises to help with that, to help relieve some of the compression. Okay. So sciatica, how it affects us, it's very painful. Some people, it only feel the numbness and tingling down the leg. Others do feel the burning, shooting pain down the leg. For some people, it does hurt to stand, especially if you have foraminal stenosis, or sit if you have disc herniation or piriformis syndrome. It literally is a pain in the butt. Let's see, with some people, it's going to decrease your interest in activities. You don't want to move because it hurts. You don't want to go work on your yard because you're having to stoop forward and that causes that shooting pain again. Or lifting heavy items because of the increased load on your spine. However, you don't want to limit yourself, and we'll talk about that later, why we shouldn't. Difficulty sleeping, you're going to be tossing and turning because you can't get in that right comfortable position. Typically, you want to lay on your back with your knees bent. That typically helps alleviate your sciatic nerve symptoms. So try that out next time you're in bed, or even after this webinar, see if that alleviates it. Usually it does. That would be a good technique to try. Nerve damage, again, like we discussed, it can inhibit the muscles there. It won't fire as well. Strength loss. So if it's not firing well, if your muscles aren't able to activate properly, then you're going to exhibit some strength loss there, or muscle atrophy. And balance deficits. Have you noticed whenever you walk and you start having these symptoms, your knee or leg kind of buckles? So it does affect your balance as well. So be very careful. Some of the do's and don'ts with sciatica. You want to exercise or be active. As painful as it can be, if you just lay around in bed all day, it's actually going to make the situation worse. Relying on the medication makes it worse as well. You start to become dependent with this medication, and some of these medications like muscle relaxers, they can be very addicting, and it's not really good for our body for a long period of time. Again, don't avoid activities. You want to continue doing your day-to-day activities. Yes, go work in your yard. That's okay. Just break it up into sections. 15 minutes here in the flower bed, 15 minutes here mowing the grass, whatever it may be. Just break it up and don't do it all at once. I know I'm the type of person that likes to do everything at once, but sometimes, to kind of control any symptoms that I would ever have, just break it up into pieces. Let's see, apply cold pack and heat instead of, again, trying to go straight to the medication. Sometimes that the cold pack or the heat is just enough to alleviate some of your symptoms. Okay. So here's some of the exercises that I want you to give it a shot, especially if you have piriformis syndrome. Typically what I have people do, I put 2 different types of piriformis stretches there just in case if it's difficult or you get symptoms with one or the other. You can always try both. So typically the first one, the seated piriformis stretch, is very simple. You just sit in a chair, cross your leg just like the gentleman there, and you're wanting to pull the knee towards your opposite shoulder. So the leg that we're stretching is the leg that you have the symptoms running down. So typically you just want to grab your knee, pull it to your opposite shoulder, hold it for about 30 seconds, do that 3 times, and you should feel a nice deep stretch at your bottom there. The other piriformis stretch, let's go ahead and go to the third stretch here. What you want to do there is you want to lay on your bed. It doesn't have to be a hard surface like a table, like that table that that gentleman's laying on. You can just lay on your mattress, your couch, whatever, whatever's comfortable for you. Bend both knees, bring the other leg onto your opposite knee, and then you're just wanting to stretch, again, the symptomatic leg, where the symptoms are going. You bring the knee to the opposite shoulder, and again, hold it for about 30 seconds, do it 3 times, and that should help control or help manage your piriformis syndrome for that sciatic nerve pain. So give that a shot. That should help. If not, try the other one. Next, just as those stretches are very important, so are nerve glides. In fact, nerve glides are, if anything, the most important thing, because what happens is with your nerve, because it's irritated, you don't want to move the nerve. Just as it's important to stretch the muscles, it's actually just, if anything, more important to stretch the nerve to make sure that that nerve along its long pathway from your back all the way down to your toes, that's pretty far, that it's gliding and moving well. You want to make sure that it doesn't constantly stay inflamed, because what happens is you're going to start getting the nerve damage, or you'll start having these continued issues if you don't do some of these nerve glides. So again, nerve glides I just heavily stress nerve glides because they're so important for you. So what the gentleman is doing here, he's sitting in a chair and he's putting his hands behind his back. You don't have to put your hands behind your back. Just stay comfortable. Get in a chair, lift the leg that has the burning, shitting pain, lift it up straight, and all you're doing is just pumping your ankle up and down. And you'll start to feel it. Even if you don't have sciatic nerve issues, when you do that, you'll start to feel it as well, almost like a stretch. But it's really the nerve that's being, I guess you could say, tugged, kind of like tug of war. Whenever you're lifting your ankle up and down, that's what it's doing. It's just flossing side to side like that. Okay, so typically with that one, I just have people start off with a minute, especially if it's their first time doing it. Start off with a minute, pump your ankle 5 times, and then drop it down to the ground. Within that minute, you bring your leg up again, pump it 5 times, and then back down. That's typically what I do, and I try to get somebody to do it for at least 3 minutes. At least that's their goal, is to shoot for 3 minutes. But start off with 1 minute, get a kitchen timer, kick your leg up, pump your leg 5 times, and then bring it back down. Okay, let's go ahead and move on to the next set of exercises. So the next set of exercises, again, there's 2 more hamstring stretches here. One for laying down, the other one's seated. It just depends on how you feel. If it hurts you to hunch over, then I'd highly recommend the one where you're laying down and stretching your hamstring that way. Typically what you want is you just want either a dog leash, a long belt, a beach towel, and you bend your opposite leg, okay? That supports your lower back, the opposite leg. And then the leg that you're gonna stretch, you wrap that towel around and you bring it up into the air and you hold it for 30 seconds. Do that 3 times. And some people do like to do both. If you want to stay symmetrical, that's completely fine. I prefer you guys doing both anyways, because it really tugs on both sides of the sciatic nerve, because it shoots down to one side and or the opposite side. So stretching both hamstrings is actually very important, not just one side. So let's move on to the next one. If it does not hurt you, or if it feels better to hunch over while you're performing your hamstring stretch, do it that way. So typically for people who like to stay hunched over are people who have foraminal stenosis. So where the foramina, again, is clamping down onto the nerve. So you typically want to do the hamstring stretch on the right, where the gentleman is sitting at the very edge of the chair, and he's just leaning forward with his legs straight. So he'll get a nice deep stretch from the back of his thigh all the way down into his calves, okay? So if you have a disc herniation or pregnant, you want to do the supine hamstring stretch on the far left. That would be your better stretch. That should feel better than the stooped one. And next, the cat and camel stretch. Looks very silly, but again, it's another nerve glide, just a little bit closer to where the nerve originates. So this is kind of working on the entire spinal cord. It moves. It also moves your entire spine, which is good and healthy for you to do. So as the camel stretch, you can see how he has kind of two humps at the very bottom, and then the cat stretch where he's kind of stretching like an angry cat. So you want to typically time yourself for about 2 minutes, and you hold each position for about 3 to 5 seconds, and then drop it down to the next position, and then just continue to alternate within those 2 minutes. Next set of exercises, again, if you like the stooping forward, the seated low back stretch is really good for you. Just using a ball, or you can use a countertop and you can do the sanding. But I prefer sitting if you're able to tolerate it. And what you do, you just grab a ball and you just roll it forward and hold it for about 5 to 10 seconds, and then bring it back up into the original position and time yourself for about 2 minutes. That'll help stretch out your entire lower back, and that'll also help move your spine, which is also good. It'll open up and gap those spaces where that nerve is being pinched. Other ways of also doing this, you can also focus on one side by, instead of just going forward, you can lean to the outside, you can lean to the other outside, and again, hold it for about 5 seconds, 5 seconds, and time yourself for 2 minutes on those lateral sides. That'll get just the outside part of your back on both sides, and it'll stretch what we call the quadratus lumborum. It's just a big back muscle on the side that can help with your low back pain or sciatic nerve pain as well. That's just another deep stretch for your back. And again, the open book here. So I'm very big on opening or gapping the spine. So with the open book, you want to do this one because all it's doing is just opening up that space where the spinal nerve root is coming out of. So instead of it clamping down, when the gentleman is lying on his side and opening the side that is affected, it tends to open up that space and help relieve his symptoms. So again, when you lie down and do this, please do the affected side up, and you want to lay on the non-affected side with your knees bent. It doesn't matter how far up, really. You don't want it to be excessive, but just enough to where you can feel your low back move, okay? Some people are so stiff that when they do this, they're going to hear some popping and cracking. It's okay. That popping and cracking it's not your bones moving or anything like that. What happens is it's just pressure that's being relieved at the joint. So you're not breaking anything, I promise. So typically you want to do that open book stretch there to gap that spot. So bridges are so good for you because one, it strengthens your lower back, it stretches your hip flexors, which are in the front of your legs there, and it helps contract the glutes, which is a good glute exercise, good hamstring exercise. Bridges are very commonly used for people who have back pain, sciatic nerve pain. I'm sure if you've gone to physical therapy before, you've done some bridges. They're just really good. Puts you in a position where it modifies you to be able to get into these later exercises where you could do squats or where you could do jump squats, stuff like that, if you're trying to get back into that. So this is just a good functional exercise. The next one, prone on elbows. People who have herniated discs or bulging discs would love this exercise more. Typically, extending your back helps relieve those symptoms. People who have foraminal stenosis, the narrowing of the spine, probably would want to stay away from the prone on elbows because that does not feel good. It'll just clamp down on your sciatic nerve even more. So stay away from that if you have a diagnosis of foraminal stenosis. Okay, that would not feel good. You want to do more flexed postures, so it'll help move your spine forward. But it doesn't mean that you can't extend your back, just maybe not for a long period of time like this exercise usually is done for. So with the prone on elbows, for people who want to do this exercise, if they have herniated disc or disc bulge, typically just time yourself for 2 minutes. Just read the newspaper like that in your bed, just for 2 minutes to start off with, or check your little phone. It's fine. Bridges, usually we do that 3 sets of 10. And again, this is just general. If you have any questions about any of these exercises, just let me know. I can help modify it for you. Be a little bit more specific with your times of how it should be completed for you. But again, these are just all general exercises. So again, before we even finish up and close, if you are pregnant and you do have sciatic nerve pain, and you want to do some of the laying down exercises, please be very careful. After 5 months, typically you want to avoid laying on your back, just because what happens is the baby can compress a certain artery, and it's not healthy for you to lay like that for a long period of time. If it compresses the artery, it makes it very dangerous and unsafe for you. So if you are pregnant and have any questions about some of these exercises or want more specific exercises than what I put on my presentation today, please do not hesitate to call me, and others as well. If you have disc herniations, piriformis syndrome, any sciatic nerve pain, and some of these exercises are working, but you want a little bit more specific exercises, please contact me. There's my email, the phone number to the clinic, and the clinic address if you just want to talk to me face to face. I love face to face interaction, and I like to make sure that you're doing things correctly. Again, you can also go to our GTC website if I'm too far for you because of the location, and go to your nearest greater therapy centers and ask a physical therapist there. Ask them, what do you think about sciatic nerve pain? How can physical therapy help me? Other than that, thank you guys for y'all's time. It's always a pleasure to give back to the community and teach you guys a little bit about what all these medical terms are from our perspective. Okay, stay safe out there, and I wish you guys the best.
All right, thanks, Miguel. Great information, very topical and certainly helpful. like he said, reach out if you guys need any additional assistance. We are here to help. The therapists are here to help. Miguel or any of our locations. We have 23 locations in Dallas, Fort Worth. Don't forget, we offer telehealth services as well if that's something you need. And we will be hosting these webinars every weekday, starting at 10 a.m. You can sign up on our Facebook page, our YouTube channel, Greater Therapy Center's YouTube channel. We'll have all of this information and all these webinars posted as soon as they are completed as well. So thanks again for joining us, and we hope to see you again soon.